New subvariant to Omicron popping up around the world, including in our part of New York. It's called BA.2 and has been seen as more contagious than previous variants. But what dangers does it pose? Alex Love spoke to doctors with URMC and Rochester General and joins us now in the studio to explain what medical experts know about it. Alex.
Well, Teresa, infectious disease specialists have concluded BA.2 already accounts for 35% of new coronavirus cases in the United States, responsible for the slight uptick we've seen in cases compared to the beginning of March, but nowhere near so far state of emergency levels. The State Department of Health calculated the Finger Lakes region has a 7-day average of 104 positive COVID-19 cases this week, not including take-home tests, over 20 more than the first week of March. BA.2 poses the same health threats as Omicron, but doctors have concluded it's more contagious.
It still can cause death. It can be a very serious disease, but it looks as if it's a little less severe.
We know that in Europe, for example, in Germany and France, cases are increasing, up 80% compared to the week before. So we hope that we don't see the same level of increase, but we're keeping an eye on it.
Because the first wave of Omicron infected more people than previous surges, infectious disease specialists don't predict BA.2 will surge as instantly as the initial Omicron wave. But the key area to watch is how many cases lead to hospitalizations to know its true threat.
We're averaging between 1 or 2 cases admitted each day with presumably Omicron. In fact, I'm sure it is. Now that's down quite a bit from our peak of about 40 to 50 per day just a month or so ago.
Vaccinated or not, nothing has changed with the CDC guidelines, which advise anyone who tests positive for the BA.2 variant still needs to quarantine for at least 5 days and mask up in public until you're asymptomatic.
If you do test positive, you should quarantine, you should isolate. If you're feeling sick, you should get tested. This is the basics.
Wearing a mask until you're asymptomatic, and certainly for a total of 10 days, even if you've become asymptomatic after, say, 4 or 5 days, you should continue to wear a mask when in contact with others.
Local doctors add this BA.2 subvariant is more likely to infect people who haven't caught COVID recently in the last half of the Omicron wave or have not received a booster shot. BA.2 shows fewer threats to people fully vaccinated with a 3rd dose. Teresa?
Thanks, Alex.